Hi, everyone, and welcome to Let's Talk Risk, where our mission is to engage, inspire, and empower the global community of risk practitioners. I'm your host, Naveen Agarwal, and today I'm super excited to welcome my guest, Bijan Elahi, once again to Let's Talk Risk. Now, those of us who are very active in the field of risk management need no introduction to Bijan. He is a globally recognized authority in the field of safety risk management of medical devices. He is a lecturer at many universities. He has been invited to many speaking engagements at different places, and he also offers a lot of training in safety risk management. And Bijan has been a guest on our show multiple times, sharing his expertise. So as we talk about our topic today, which, by the way, is going to be the International MedTech Safety Conference that Bijan is organizing in 2026 in Boston. But as we talk about that, I invite you to continue sharing your comments and questions if you have about risk management. And this could be a great opportunity to also engage with Bijan to get his perspectives on some of your questions. So be a part of it, and I hope to have a great chat on this topic. So Bijan, with that, thank you for coming again to the show. How are you today?
Great. A pleasure to be here, Naveen, and thanks for inviting me. I always enjoy your Let's Talk Risk sessions and try to attend as many of them as I can.
Wonderful, Bijan. Thank you so much. And now, as I mentioned in my brief introduction, Bijan, you engage with so many people across the board in universities, in companies, in small gatherings. You come across so many people who are interested in safety risk management. I want to start by asking you, what are you hearing from them these days? What is top of mind for them in terms of the emerging themes, emerging questions, or topics about medtech safety risk management?
Yeah, of course, I think as it goes without saying, AI is on top of mind for everybody, and just about every medical device company is incorporating AI somehow into their products, unless it's just purely mechanical. So people have been bringing that subject up, and that, of course, will be a major theme in our conference in 26. Another topic that is coming up often now, more often than I had thought, is combination devices, how to manage the risks of combination devices. Cybersecurity seems to have kind of faded a little bit to the background. I guess it's not really that it's less important, it's that these other topics are so big that they're becoming a little bit relatively bigger. So yeah, these are the things that I hear more often now.
Okay, wonderful. Yeah, of course, this is what I have observed too in my conversations and the kind of questions or comments people post on LinkedIn. This seems to be top of mind. But risk management from a conceptual perspective, it is not that different from one place to another. It's the how-to piece, right? How do we apply? And from that perspective, I think the conference that you are organizing offers people a great opportunity to learn the practical know-how, the how-to tips, and also be able to network with people who have more experience.
Mm-hmm.
So we're going to jump into that in just a little bit. But guys, as you are joining our session today, once again, my guest is Bijan Elahi, and he's leading the next International MedTech Safety Conference in Boston in June. And we're going to talk about that today. So Bijan, let's trace back the history a little bit. This is a pretty recent initiative that you have taken. Tell us how it all started and why you felt there was a strong need for a dedicated safety risk management conference.
Yes, good question. So what happened is that I've been in the field of safety risk management for over 30 years, and I used to go to conferences related to system safety. But I noticed that the attention was mostly on other industries like aerospace, defense, chemical, nuclear, automotive, but not much attention was given to medtech. And I really tried hard to encourage people from medtech companies to come and speak at these conferences, but there just wasn't enough traction. So finally, about 3 years ago, talking to some of my other colleagues who were also interested in the subject, I said, why don't we just have our own conference? And that was toward the end of 2023. We talked. At that time, I was working at Medtronic, and I talked to Medtronic about allowing us to use their headquarters to just have a small gathering of people that are interested. And they were generous and allowed us to use their beautiful headquarters. And even the CEO of Medtronic, Mr. Jeff Martha, came and spoke to kick off the conference. And to my surprise, we completely sold out the space there. And we had to go online, give an online option because there was not enough seats. And that really surprised me. And we had a lot of people that came from Europe, from other countries to the conference. So we thought, well, there must be a need. It was more than I expected. So then we moved the conference to Europe, to Amsterdam in 2025. The conference grew by 400%. So I mean, that tells me that we have hit a need. There's a lot of interest in it, and so now the momentum is building, and you're coming back to America. And I'm just leading this grassroots effort. There are a lot of volunteers, a lot of people helping. It's really a conference by the community and for the community. And I think that's one of the reasons for its success. It's not a commercial thing. It's really a group of people who are passionate about the subject. They want to get together. They want to share best practices, the latest thinking, and it's really a good time too. People really enjoy being there. So I mean, it's a great event.
Yeah. And, I feel like you have tapped into a very strong need in our community where we do feel the need for a more focused conversation around safety risk management of medical devices. It's a complex topic, which becomes very difficult in practice. There's a lot of, I would say, theoretical knowledge out there, a lot of guidances, a lot of standards, but the how-to piece is missing. And I think that is where there's a strong need. And the conference, I was at Amsterdam with you in that conference, and I totally see it as how people are craving for more knowledge of the practical aspects of risk management. And I think this is where you are tapping into it, and you are organizing your conference around that need. So now let's talk about, what are your plans? What are your plans for 2026? In what way is it going to be different from 2025? Can you help us understand your big, first of all, your big theme is proactive safety from clinic to, right? Tell us a little bit more about that first.
Well, it goes without saying that it is smarter to make a device safe from the concept stage instead of designing it and then figuring out maybe we need to attach some safety features to it. So that's what the theme is. Proactive safety means start thinking about designing devices in a safe manner from the beginning. It's for efficiency. So what's kind of evolving? This conference is evolving, and I teach in universities, as you mentioned yourself, and I'm very interested in also empowering universities to offer this training, which is rarely available. Just very few universities in the world offer this, and I teach it in Europe and in America, but there are not that many people who teach this. So the universities are interested in incorporating this into their curricula, and that's why we are hosting this conference in 2026 at Northeastern University campus in Boston. And there are other technical universities like MIT who is going to participate. It's kind of a gathering of the minds that are really interested in this subject. So besides the industry, which is the major participant, we have academia now that are participating. Last year, we had 4 universities that participated. And then government. I'm honored and just excited to say that Dr. Michelle Tarver, who is the director of CDRH, has accepted our invitation to come. And it just shows how important this conference has become on a global scale, that the head of CDRH is coming to speak to this global community. In 2025, we had Sud TV from Germany that participated. So it's a great place for the industry to be able to have comfortable discussions, maybe side conversations, on breaks with these regulators, and pick their minds and know what's going on behind the scenes. And plus, the industry. I mean, the main reason for getting together is the industry to share best practices, talk about areas that are top of mind, like as we talked about AI or cybersecurity or combination devices. And also what I'm excited about is that there are some young people, even the graduate students or young professionals that are interested, and they're going to be coming there to talk about what's really keeping their minds occupied about this subject. One young lady talked to me. She was saying, there's some very basic concepts, like what do we mean by occurrence? How do we measure occurrence of an event? And that, of course, drives P1 in risk calculations. And so she wanted to really dig deep into that. And she said, I want to come and lead a discussion. I said, great, you should come do it. And so I'm looking forward to her and others like her to come and talk about the areas that they're passionate about. And everybody's going to benefit from this.
That's wonderful. We have a great comment from Dr. Juan Dakash, who is sharing that it's a much needed space to optimize a global harmonized way to look into safety. Much, much needed. Thank you, Juan. Now, Bijan, you mentioned Dr. Michelle Tarver from FDA CDRH. I'm excited, but to be honest, I'm not really surprised because think about it. What's going to happen in February 2026? We're going to move to QMSR, right? And that has the foundation in 13485, which is all about risk management. So this is going to be a new way of looking at compliance to FDA regulation for MedTech. We're going from QSR to QMSR, and risk is the foundation for that. So I think the presence of Dr. Tarver really sends a strong signal to everybody that we got to start taking it seriously. It can no longer be a side activity for, documentation and compliance purposes and design control, but really a message I'm sensing, and I'm really excited to hear what she has to say. But I'm reading the tea leaves here, where the strong message is going out from FDA to the industry that risk management is no longer an academic activity or a documentation activity. So, am I kind of stretching the thinking here a little bit? That's how I feel. What do you think?
ISO 13485 talks about risk-based approaches in general, in all kinds of ways, in supplier controls, in verification, post-market actions. And when we talk about risk-based approach, the word risk tells you need to know what risk is. And unless you do risk management, you don't know what your risk is.
Correct.
So risk management becomes a fundamental contributor to all aspects related to QMSR. So I think maybe this is why we're getting more and more attention. And it's a rational, defensible, clear way of making decisions. So I'm happy that things are going in that direction. Of course, my focus is safety and risk, but quality management system is also an adjacency for me that is connected and is benefiting from the production of information from risk management.
Yeah, because I think it is the glue that binds everything in the quality management system, right? And if we learn how to do it right, and this is what I'm most excited about, that people are interested in the how-to piece more than the what piece. There is a lot of conversation around the what and the why, but it's the how-to that you gave a great example of basic misunderstanding of key terms. And trust me, this is not just students or early career professionals. I have seen this misunderstanding across the board. That's the reason why we have so many conversations on Let's Talk Risk at a very high level, informal level, to understand these concepts in a deeper way. So I'm truly excited about that. Bijan, so tell us a little bit more about the program. What do you have in mind? I know it's still evolving, but what do you have in mind for June?
Yeah. So the conference is growing still. We grew by 400% from year 1 to year 2, but we are still growing now into year 3. I have added a 4th day now to the conference, what I call the day of collaborations and connections. So the way the conference is structured is we're going to have a pre-day, which is going to be Tuesday, June 2nd. That will be a day where we will offer many workshops and tutorials where we'll have great teachers such as yourself that will make available knowledge for practical information and knowledge, some with hands-on experience in workshops. So that would be Tuesday. Then the first day of the conference would be June 3rd and June 4th. These are the 2 days where we'll have formal presentations and keynote speakers. And then on the 4th day of the conference, which is 5th of June of 2026, is the less structured day, which I'm actually quite excited about. As I said, I call it Day of Collaborations and Connections. This is where we will have many, perhaps as many as 20, not all simultaneous, but 5 simultaneous, but about 20 level democratic discussions, basically roundtable discussions that people can sit around a table, talk with each other, confer, share ideas. And I found that at least we kind of stumbled on this idea in 2025, in April 2025 in Amsterdam. We had just allocated about 2 hours for this, and people really were interested in it. They loved it. They made friends. They connected with people from maybe other companies that they wouldn't have otherwise, and they found some themes that they were interested in, and now they're working together behind the scenes, making more advancements. And at least one of them is going to come back in 2026 and report out what they have accomplished. And in a way, I think this is how the grassroots can move standards, because we can feed this kind of knowledge into maybe regulatory bodies, into standards organizations, and I think it's a good synergy.
Wonderful, wonderful. That's awesome. Bijan, we have great excitement among our audience too. We have many comments coming in. I'm going to read a few of them. The lack of training is a key concern. The principles, structure, and math of safety risk management is similar across multiple industries, but practices are still very industry specific. Great point. And that's why talking specifically in the context of MedTech is very important in this conference. Dr. Juan Dakash is sharing again that it's a great opportunity to look into primitive stages of AI regulation, AI EU Act versus what the FDA is trying to incorporate. And Esteban actually is showing our true excitement. Great to see the risk-tastic duo, Naveen and Bijan, performing a live talk again. Esteban, thank you so much for joining today. I love your enthusiasm and excitement. So Bijan, let's continue our conversation. And by the way, guys, you're welcome to continue sharing your comments, questions, any ideas you have for Bijan, because we are still in the early stages of developing the program and agenda, and you have an opportunity to shape this, right, Bijan?
Oh, yeah. And I've been actually requesting from the world, everybody in the industry and in the community, share your ideas and thoughts and suggestions with me. This is our conference. We are building this together, and to make it the best that it can be, it takes many minds. So I welcome and appreciate your advice, your help, your tips, volunteers. It takes a lot of people and a lot of work to put this together.
Yeah. And Bijan, let's not forget, we also have a survey that people can complete. It's like a 5-minute survey, and we can drop a link to that in the comments. Please, more than 100 of you have already given us feedback, but we are always looking for more feedback from you. Okay, so let's talk more about how people can participate.
There are many ways that you can participate. One of the simplest ways is just to attend. So that's the easiest way. You can also participate by teaching. We have a Day of Education on the 2nd of June, where we have two simultaneous tracks and 8 sessions of training and workshops. So if you can share some knowledge, if you have some expertise in an area, please send me a proposal. Just all you have to do is to go to the conference website, submit an abstract, and choose that you want to teach. And then that's one way. Another way is to be a formal presenter. So you can submit an abstract to speak on a topic of your interest. There are some tips and advice on the website's page on what topics are interesting right now and top of mind, but we're not limiting you. Submit your abstract. You can submit even more than one abstract. And by the way, today was supposed to be the deadline for abstracts, but some people requested extra time because they were still refining their abstracts. So we extended the deadline to December 31st. We thought we'll just give more people a chance. But the sooner you submit, the better.
Wonderful. So Bijan, I'm sure a lot of people are interested in submitting their abstracts. Let's also share with them very transparently what criteria you're going to use to select. I'm sure we'll get a lot of very high quality abstracts, but share with us what the process of selection would look like.
Yeah, so all the abstracts are reviewed by a panel of experts. Each abstract gets multiple reviews, and the selection criteria are also on the website. There are 4 criteria. First, relevance to safety and risk management in MedTech. So if somebody is writing an abstract for risk management for example, fighter aircraft, it probably will not get selected. It has to be related to MedTech and safety. The second criteria is about the practicality and applicability. We like to give useful practical information to our delegates. So if you can share that kind of information, that's an advantage. Third is originality. So if you have something that's original, it doesn't have to be original. There are not that many possible original ideas, but that's another criteria. And then the fourth criterion is speaker experience and expertise in the topic area. So if someone is a expert in an area, is well known, that carries more weight than that.
But the good news here, Bijan, is that there's more than one way to contribute, right? So we should encourage people to do the best they can and not just rely on maybe one idea or 2 ideas. You can submit as many as you want. And the point here is that if the abstract is not selected, it's not because it is not of good quality. All of us have a lot of expertise and things to share, but it's because there are a lot more other ideas and abstracts that are more appropriate for the theme and of high quality. So there's no it's not a reflection on the quality of the abstract, but rather the fit with the conference.
Yeah.
Is that, am I reading that correctly?
Yeah, and this conference now, because it has grown to 4 days, now we have more space, so we can take more abstracts, and we've created more space. Like first year was just 1 day, one track. Now
Correct.
we have grown it by a lot, so there's more space. We, don't be intimidated. Just submit your abstracts. There was another way that I didn't finish saying that you can participate, and that is by leading a discussion on the day of collaborations and connections. And this way, this is a little bit less formal. You don't have to like stand up in front of a large crowd. It would be small groups, maybe 20, 30 people, maybe 10 people. And you talk about the topic of your interest, and you can lead that discussion. So there are many opportunities to do that as well.
Yeah, great. Bijan, we just want people to feel that they have a great opportunity to connect, engage, and inspire each other, share their expertise. And there are more than one way of doing that.
Yeah. Yeah.
And I've said that many times on Let's Talk Risk that, even though one of the criteria that you have is the experience and the knowledge of that individual who is submitting the abstract, I don't think that should hold people back, because there are so many great ideas that can come from people who may not have a lot of experience. So it's not like one criteria is going to be weighted more than others. I don't know the process, but I was involved in your process last year, and I can tell our colleagues here very transparently that it is a very, very rigorous and objective process, guys. There is no favoritism or anything like that. So I want all of us to be very confident that if we put our best foot forward, that would be evaluated with great care and great sincerity, right?
Absolutely. Yeah.
Okay.
And I was going to say that two extra special things that we will have in this conference is, one of them is that the document ISO TS 24971-2, which is about application of safety risk management to AI ML medical devices. That's going to be released, I think, just before the conference. And Pat Baird, who is the leader in creation of that, is going to be attending the conference and talk about it. So we're going to get the freshest information on AI safety risk management. And then the other one is the ISO TR 24971-3, which is a document about risk management for combinational devices. This is the first time this document will be released. And Susan Needle, who is also a world expert in the area and the leader in the creation of this document, will be a speaker, and she's going to tell us about the latest knowledge in that area.
Wonderful, wonderful. We do have a technical question. I want to save time for that. But Bijan, very quickly, can you please tell people about your early bird discount offer so that they can take advantage of that today?
Yeah, thanks for bringing it up. Right now, there's a limited quantity of early bird tickets which are discounted that are available. If you register, it's a first come, first serve. You can take advantage of that. The website is very simple. It's medsafety.net, medsafety.net. And just go there, register, and grab your ticket.
And you have posted a link to that website already in the comments section. Is there a deadline before which the early bird, after?
It's both by quantity and time. So once the quantity runs out, or December 31st, whichever comes first, that's the end of it. So
okay. So here's what I will say, guys. If you want to make a business case to your leadership why you should attend this conference, submit an abstract, make a case, but also tell them here's an opportunity to save some cost if we register early. So Bijan, I do want to handle this technical question, which is very good. How does one quantitatively address residual risk utilizing clinical data? Can we speak to that very briefly?
Well, I would say maybe post-market data, if you're talking about clinical data. If you're talking about pre-market, then you're doing a prediction. But if you're talking about post-market clinical data, that's different. That's drive the P1 and P2 numbers. It's kind of, the question is not that clear, so I'm not exactly sure.
I think, of course, this could be a topic in itself for a conversation. And Devina, you have submitted a great question. We will pick that up. What I will tell you is there is a beautiful guidance from FDA that you should review. It's the benefit risk guidance about medical devices, but it applies to PMA and de novo devices, but it can apply to any device. They have a very good worksheet and a questionnaire that helps you to go step by step into evaluating these residual risks in the context of the benefit. So I'll point you to that, but we will address these kind of topics in our future conversations. So Bijan, we're coming close to our 30 minutes. I'm going to give you a couple of moments to just think about highlighting 2 or 3 key points. And then in the meantime, I'm going to share some announcements with you guys. We briefly touched on this about how QMSR is going to be effective in February and how it is tied to risk management. And in order to, in a way, help you understand that a little bit more, I'm launching a series on Let's Talk Risk, which you can think of it as your 90-day QMSR readiness review. It's going to be launched beginning next week, and you will have a series of content to kind of learn from and reflect upon, and hopefully that will be helpful to you. So if you want to be a part of that information network, just join my Let's Talk Risk newsletter. I will share a link with you where you can subscribe. The next announcement, which I'm continue to remain very excited about, is a 4-hour hands-on workshop I have developed for using ChatGPT for analyzing adverse events and recalls data. We go through a case study and we go through many worksheets step by step how you can work with ChatGPT to analyze a large body of data and extract some insights. The second session is going to start soon. I'm going to open the registration. It's limited to only 10 people. If you're interested in that, reach out to me as soon as possible and I'll put you on the list of those people who are interested. With that, Bijan, the floor is yours. Please highlight 2 or 3 key points for the conference.
So I would suggest try to come to the conference in person, if at all possible. It really is such a great experience. But if you can't come in person, we have an online option too that you can register for. The first day, the tutorials and workshops, and the last day are not online, but the middle 2 days where there are formal presentations are online. And another thing is that if you are a person who is looking to advance their career in risk management, this is also a great forum. I know that some of the companies are talking about wanting to recruit, and so you may be able to even find a new job if you come to the conference. So do come, if at all possible.
Nice. Many reasons to attend, guys. And I hope you are as excited about this conference as me and everybody else. Please reach out if you have any questions about the conference, need more information, need help in making a business case to present to your manager for supporting you to come to this conference. I think we'll all be very eager to help you make the best out of this opportunity. Bijan, thank you for coming again to the show and sharing your perspective. You are doing such enormous work. One thing I'll tell you, everybody, Bijan makes it sound very easy. He does so much work behind the scenes to put this conference together. It is tremendous, and I've seen him in action. He deserves a lot of our gratitude and really this great feeling that we can give him to support in this effort. So please reach out to him and share with him how much you care about this field and in what way you can support this. So thanks, Bijan, for doing this for all of us, for the field. I wish you all the best. And guys, thank you for joining us today.
Thank you.